I thank the member. The question is the bill we now read a second time. I do call the member for Pittwater.
Mr Assistant Speaker, I rise today to speak in strong support of the Health Services Amendment Public-Private Partnership Prohibition Bill 2025, also known as Joe's Law. This bill will prohibit any new public-private partnership arrangements for the construction and operation of public hospitals in New South Wales. It is a necessary and direct response to a deeply flawed model, and as other members have mentioned, one that the bill before us today has responded to the tragedies faced by many families, but particularly the Massa family. It's had devastating consequences for my community, and mostly for those who have trusted the healthcare system, who have been let down. As we've seen with Northern Beaches Hospital, the public-private partnership model is just inherently flawed. It's a conflict, and an inherent conflict that runs the risk of putting profit above patients. It's an example of the complexity of the problems that occur when you have a private enterprise delivering public acute services, and it has failed the people of Pittwater. I want to acknowledge that people, as the member for Manly mentioned, have had good experiences at the hospital, but many have had tragic ones. Public-private partnerships may have their place in infrastructure delivery. They can work for toll roads or for stadiums, but not for public hospitals and acute care. Healthcare is not a commodity. It is not a service that should be rationed or optimised for shareholder returns. It is an area where a good deal or a very good deal results in chronic underfunding and compromised care. And when profit and commercial KPIs become motives in the delivery of acute healthcare services, it ultimately puts lives at risk. The Northern Beaches Hospital's privatisation was sold to our community as efficient, as fiscally responsible, and delivering better healthcare for my community and my constituents. But many in my community have not experienced that. At the time, when we lost Mona Vale Hospital and then Manly Hospital, we had a strong community movement standing up, fighting to save Mona Vale Hospital. There were always concerns in our community around the public-private model, and people in my community fought hard to resist it. They've been disappointed in the new location of the hospital, which for some in Palm Beach is even a longer commute, which put lives at risk when you're travelling in an ambulance. Fewer beds, a broader catchment area, lack of services such as stroke, cardiothoracic surgery and neurosurgery, to give examples, and a hospital that continues to be marred in controversy, often underperforming where it matters most: patient outcomes, access, and of course transparency in the agreements. In theory, public-private partnerships do well. In theory, private business can do more with less, and that efficiency delivers value for the taxpayer. But when it comes to healthcare, there is a hidden cost, and in the case of Northern Beaches Hospital and other public-private partnerships, that hidden cost can be lives. And we know from the Massa family and their tragic loss of their son Joe, and their courage and bravery to stand up in the media and draw attention to the issues, that these tragedies occur. Since then, we've also had the Atkinson family come forward and the loss of their baby Harper. Before this, there was the Gill family who lost their son Joshua, the Wilcock and Hogg family who had their loved Sophie Hogg suffer a traumatic brain injury. Even the other day, I was helping a lady across the road who suffered a stroke that wasn't diagnosed for many days in Northern Beaches Hospital. Constituents have written to me, and I know they've written into the audit and the current New South Wales parliamentary inquiry with story after story about how the hospital has failed them. We've also had local media draw attention to the lack of transparency around the hospital. We've had the New South Wales parliamentary inquiry many years ago. And of course, we've had the change in ownership, one that was enabled by the federal government under Scott Morrison and Josh Frydenberg, with Brookfield taking over, and with Brookfield being based in the Cayman Islands, even more opacity as well. I want to acknowledge all the people that have stood up and shared their stories, and I encourage more people to share their stories with the current New South Wales parliamentary inquiry. I want to also acknowledge the member for Wakehurst, the federal member Dr. Sophie Scomps and Zali Stegel for standing up and calling for greater transparency, and particularly calling for the New South Wales Audit Office's recent inquiry and release of their report only a couple of weeks ago. Both the member for Wakehurst and I also called for the public inquiry, which is now underway as well. However, as we see from the report released only a couple of weeks ago, the more that is uncovered, the more questions that are really raised. Obviously, the inherent complexities of a public-private partnership and the delivery of healthcare through that model have been brought to the fore. But some of the questions that raise go to, the level of the deal. Was the deal a good deal or a bad deal? And as I mentioned before, a good deal to the taxpayer can lead to underfunding, and a poor deal to those who have to be patients in the hospital. There are questions around who bears responsibility for, if there is underfunding, for filling that gap, whether it's the corporation, Healthscope, who have signed on to the agreement and negotiated the agreement and have the ability to raise capital and owned by private equity, or is it the New South Wales government who should bail the operator out time and time again? And we know from the audit report that $73 million has been given in addition to the negotiated agreement already. And also, I believe, $70 million in reduced liability as well. I know, and I refer to the member for Wakehurst, who referred to the submission of the Medical Staff Council at Northern Beaches Hospital, who have highlighted that it is lack of funding that has resulted in some of the discrepancies against benchmarks for public hospitals. And I note again this inconsistency with the audit report saying that the hospital is clearly failing the people of the Northern Beaches and not performing against the deed. Yet in some aspects it's also meeting some of the, and outperforming on some benchmarks compared to other public hospitals. However, it is also highlighted as well that some of the KPIs and data management is somewhat lacking, and there's inconsistency in the data which is currently under further investigation as well. And that's also brought up by the Medical Staff Council. But some of the discrepancies in care that is highlighted in this is discrepancies, and this is, and I quote directly from their submission, which is discrepancies in staffing numbers impacting on waiting times in the ED, the quality of care and burnout amongst staff, discrepancies in the services offered compared to other public hospitals, and I've mentioned cardiothoracic surgery, neurosurgery, and also stroke, discrepancies between medications and doses of medications available to hospital patients at Northern Beaches compared with other hospitals in the local health district, oncology, huge deficiencies in staff, nephrology, huge deficiencies in staff. Even the choice of consumable equipment in Northern Beaches Hospital is limited compared to public sector. The list just goes on and on and on. And I know that they've also felt that the staff are the ones to pick up the slack, and there are huge complaints around staffing and the risk of burnout and actual burnout. And they are the ones trying to continue to provide quality service when they are restricted by funding and the management of Healthscope. I think all these things are a perfect illustration of the complexities that arise when you have a public-private partnership. There have also been legal battles, and those complexities and lack of transparency and the inherent conflicts about efficiency and putting profits over patients and profits over people illustrate why we just can no longer have public-private partnerships when it comes to healthcare. So I am supportive of this bill. My community is supportive of this bill. Obviously, it is not a remedy for our hospital. It's for all hospitals going forward. But that at least now that there is a line in the sand. We, of course, cannot bring back the lives that have been lost and the lives impacted. But to those families that have stepped forward, they have created change in New South Wales. And for that, I thank them, my community thanks them, and many in here thank them also. One of the telling comments that was of the submission that I mentioned earlier is that from the beginning and from the outset, doctors felt they weren't listened to and their concerns were systemically ignored by Healthscope in the years preceding the opening of the Northern Beaches Hospital. If there's any lesson we learn, it is we must listen to medical professionals, and we must, as we transition out of Northern Beaches Hospital, if that happens, must continue to listen to medical professionals. So I commend this bill to the House for no more public-private partnerships in New South Wales when it comes to healthcare.
I thank the member. The question is bill be now read a second time. I
Speaker.
call the member for Strathfield.
Thank you, Mr Speaker. I rise to support the Health Services Amendment PPP Prohibition Bill 2025, a bill born from the grief of Eloise and Danny Massa and